I'm gonna be doing the musculoskeletal video, but I don't have a real person, so I'm gonna be doing it on a pillow. So, hand hygiene, I'm knocking on the door. Hi, I'm Pam. I'm gonna be your student nurse today. Can you just tell me your name and date of birth, please? Alright, just gonna check your wristband, make sure that matches. Awesome. Before we start, do you mind if I record for my class? No? Okay. Also, before we get started, do you have any pain in your joints? No? Alright. So first thing I'm gonna do is I'm just going to assess your range of motion, your upper extremities right now. But I'm gonna inspect the neck for any lesions, masses, asymmetry. And I see that the skin skin color matches the patient's ethnicity, and there's no lesions, no cervical or muscular deformities. Now I'm going to palpate your neck to let me know if you have any pain or tenderness. So I would palpate the cervical spot, like the cervical part of the neck, and then also the sides. Any pain or tenderness? No? All right. Now I'm just gonna test your range of motion. So for the neck, we would have them have their chin touch their chest for flexion, extension, and then look to one side for rotation, the other as well, and then also rotate for rotation, and then you would do all of that against resistance. So I'd push against your head, and then like that, like that, like that, and yeah. So I can see that the patient has full range of motion +5 strength. Now I'm gonna inspect your upper extremities. I would check the shoulders, elbows, wrists, hands and fingers. Obviously my pillow doesn't have that, but inspect for any asymmetry or deformation. And I see that the patient's upper extremities are symmetrical, have no deformities, and no muscle atrophy. I'm gonna palpate the above joints with the back of my hand. Obviously the pillow doesn't have that, so I palpate with the back of my hands from the top. So shoulders, elbows, wrists, hands and fingers. And then I would say skin is warm, dry, intact, no pain, crepitus or masses. Now I'm testing the range of motion for the upper extremities. So I would, for abduction and adduction, I'd go like abduction, adduction, and then for pronation, supination, and then flexion and extension and flexion. And then I would do all of those against resistance. So yeah, I would push against whatever way the patient is going towards. Can't do that with the pillow, but that's what I would do. And I would say full range of motion in all joints of upper extremities, +5 out of 5 strengths. Now we're moving on to the lower extremities, and again I'm starting with the inspection of the lower extremities. I would look at the hips, legs, knees, ankles, and feet. And then I can see that the lower extremity joints are symmetrical, no deformation, no muscle atrophy or arrhythmia. And then I would palpate with the back of my hands, just like I did the upper extremities. So it would be like down. I would do the hips, legs, knees, ankles, feet. And I would verbalize my findings by saying skin is dry, warm, intact, no tenderness, no pain or masses, no crepitus either. And then now I would test range of motion for the joints of the lower extremities. So flexion and extension, the patient would this is elevation and depression, so lift their leg, bring it back down, do it for both. And then flexion is going like this, so putting the knee towards the abdomen, and then extension, which is putting the leg back out. And then I would do abduction, which is out like this, and adduction coming back in. And then I would do plantar and dorsiflexion, which is they would dorsiflexion would be pointing the towards toward me, and then plantar would put your toes towards the ground. And then rotation is just moving the foot in a circle, well, the leg, both of them. And then and I would do all of those against resistance as well, so just to test for muscle strength, and then verbalize how strong the patient is. But for this video, I'm just going to say +5 muscle strength on the lower extremities. And then now I would inspect the spine and look for any that skin color matches ethnicity, no lesions, masses, or anything like that. Palpate the spine. Palpate the spine. Palpate the spine by having the patient bend over like this and look at it from the back, and then palpate from the top to the bottom, from cervical, lumbar, thoracic, and then test range of motion. So I would have her go like this, and then flexion, extension, and then lateral bending, so side to side. And then for the other one is rotation, so just look back, look back, moving only your spine. And then verbalize my findings, full range of motion, +5 strength. And then yeah, that's the end of the video. Thank you.